bit different. Perfect. So with dialectical behavior therapy skills, there are a few different categories of them, and we're going to break them down for at least 4 of them, although if there's interest in looking at some of the tools for some of the other skills, we may be able to add additional ones there. But before we get started, I did want to have a disclaimer, especially with our diverse interprofessional group out there. I'm a pharmacist by training. This is not within my wheelhouse. I am not a certified DBT therapist. This is not designed to be a therapy session. This really is an overview of the DBT skills with a focus on mindfulness for today. So informational only, and I just want to put that out there. I will be relying on a number of you, which I know have experience with some of the DBT skills and examples as well to help me out throughout the presentation. So the goal that I have for this presentation, we're going to list the 4 categories of skills in dialectical behavior therapy. We're going to identify the skills specifically with mindfulness. That's the first one that I started with. That one seems a little more gentle than some of the other ones. And we're going to describe some mindfulness practices that can be incorporated to help work on those skills. And I guess I'm going to lay the challenge out there a little bit, not necessarily just for patients or those with a particular diagnosis. Since this is the first in the sequence, I wanted to start with what dialectical behavior therapy was. So DBT is a structured psychotherapy program. It was developed by Dr. Marsha Linehan in the 1970s. So Dr. Linehan herself has a history of mental illness, and she had done pretty extensive work working with patients who were suicidal, as well as a number of patients who had other mental health conditions. DBT coming from really looking at the behaviorism aspect and taking pieces of cognitive behavioral therapy, as when she was working with suicidal patients, self-harm patients, and patients with borderline personality disorder. Neither of those schools of thought really helped address everything. So she really worked with her team on which of the skills seemed to resonate and be more beneficial with some of these patients. This has expanded the focus and utilization of DBT. There is a certified training program. It includes training as well as supervision. There's an emphasis on fidelity to the model. Individuals who are in DBT services may have individual therapy, they can have group therapy, they will work through the modules. There often is homework for individuals. So it really can be used in a number of different modalities. The focus had been in some of those higher risk patients, but it has moved quite extensively. And one of the reasons that I volunteered for this was, as I took on our wellness curriculum in the College of Pharmacy, one of the things I did in preparation was to attend a workshop that was offered over the summer, last summer, that was focused on DBT skills in schools. So there are some examples of individuals who are trying to incorporate DBT skills for students, just general students in schools, as well as now I lost my page, as well as folks in both college, undergraduate programs, and in professional schools. So recognizing that the skills that are involved with DBT really can be beneficial far beyond just patients who are in significant distress. It really can be beneficial for a much broader audience. So one of the pieces that makes DBT therapy a little bit different is the dialectic. And this is really important from a foundational concept perspective, that we're on the same understanding, because this is going to be what a number of individuals need to work on. So dialectic, I started at the dictionary to see what they had for their definitions. Not all of them were applicable. The closest was any systematic reasoning, exposition, or argument that juxtaposes opposed or contradictory ideas and usually seeks to resolve their conflict. I was not super satisfied with that definition because it really didn't help me. It really didn't help me in terms of what does this actually mean? What is it that we're trying to work on? There are a number of the other training manuals that define dialectics as reality, as that reality as a whole consists of opposing forces, that change is constant and opposites can be true at the same time. So it's really looking at some of those situations, things that are not black, that are not white, that fall into the gray category. So you may have a situation where one individual believes that all good things come to those who wait, and that the optimal course of action is going to be not to do anything at this point. At the exact same time, looking at the exact same situation, there may be someone else who's thinking, but time and tide wait for none. We need to take action and we need to do it right now. Those are both truths that really are completely opposed to each other in terms of what the action should be, none or something, but both of them are true for these individuals at the same time. So the dialectic behavior therapy really is to help address some of these situations where multiple things may be accurate and true for the different individuals who are involved, and there's not necessarily a very clear, specific right answer. So finding ways to be able to manage a number of these situations, which as you think about it, can happen all of the time. So categories of skills that get worked on in DBT. So there are 4 main categories. These are the 4 premise that I'm going to base each of the subsequent presentations on. Mindfulness being the first one, because that was a little bit more straightforward. Emotion regulation, distress tolerance, and interpersonal effectiveness. And I just kind of want to take a split second to reflect back. Yes, all of these can be really beneficial for folks who have different personality disorders, may have suicidal ideation or be engaging in self-harm, who may have a number of different types of mental illnesses, substance use disorder, post-traumatic stress disorder, major depressive disorder, anxiety disorders, eating disorders. However, most of the general population needs to be able to successfully manage this to be as optimally functional as they can. I worked with someone who had made the comment that coping skills, really working on coping skills that put you in the position to be most successful, really aren't taught till folks get in trouble. So there are some folks that may be doing okay that are not intentionally doing things, but just have managed to be able to figure out through trial and error how best to manage different situations. So this really is designed to look at some skills that can be beneficial that maybe we can think about ahead of time to cope ahead of those difficult situations that any of us may encounter. So we're going to focus on mindfulness, as that was the first one. Wanted to start with definitions. So mindfulness, defined by the APA Dictionary of Psychology, is awareness of one's internal states and surroundings, so both internal and external awareness. Many of the training manuals talk about mindfulness as being in control of your mind, as opposed to letting your mind be in control of you. And I love this picture. It was from the University of Michigan's Health and Wellness Center. So sometimes there may be times, I will speak from experience, where your mind may just run away with things. There's all this stuff that needs to happen, and I'm really being driven to make decisions that aren't necessarily maybe in my best interest, but because you're distracted by other things or not really paying attention and focusing on what's going on in front of you. So this really is helping to take some control back, which may be important, especially in this day and age. We all have cell phones and tablets and all kinds of other devices that will allow you to have a tremendous amount of distraction and escape, but may also make it feel like you're no longer in control, that you don't get to drive the bus, that you don't get to make some of those decisions. So this really is an intentional practice to help remind individuals and to practice being in control of your own mind. So how does mindfulness relate specifically to DBT? So it is that focused attention. So the attention and awareness of the current situation are really important. So focusing attention on one item at a time, being aware of what's going on without necessarily judging it. Promoting self-awareness and emotion identification. If there's a particular way that you're responding, being able to put the brake lights on, be like, hold up, why did I respond that way? That may not be the way that I normally would respond. As I shoot off an obnoxious email response that maybe was not in my best interest to respond that way. Well, what's going on? Do I feel anxious? I feel out of control. I feel distressed because maybe there's a time crunch. Maybe there's something else that's going on. So really trying to promote those moments of reflection to be able to do that. And then contributing information that can be used for that decision-making, recognizing that, you know what, maybe I feel a little overwhelmed right now. I shouldn't be making rash decisions. I really want to take a moment instead of doing what's quick and easy. Let me see what really would be the best decision for this particular situation. So with that in mind, the specific goals that Dr. Lenahan identified for mindfulness in DBT, she actually went on to become a Zen master. So she did incorporate a number of these intentionally. It was the first set of psychotherapy that really helped incorporate mindfulness and think about this, was to reduce suffering and increase happiness. So to assist with, not that everyone's going to be happy all the time, but to assist with that emotional stability and sense of well-being. Maybe there aren't a ton of times that individuals feel happy, but being in tune to it and being able to reflect on, yes, that does occur, really can be helpful when maybe some folks are feeling real overwhelmed most of the time. If their anxiety is a little bit out of control, maybe they're struggling with an eating disorder, being able to reflect on times that, no, I have done this and it hasn't been that bad. Increasing the control of our minds, again, that focus, attention, and awareness, and experiencing reality as it is. And I think this is important. So being present to life as it is, as opposed to how we think it should be. I have successfully raised 2 teenagers who are very independent, and they have very strong opinions on how they believe life should be. And both of them are coming to realization that how they would like life to be or how they think it should be isn't always what it actually is. So being able to successfully navigate situations where those two aren't congruent is going to be really important. In order to do that, to be able to successfully do that, there are 3 mindfulness skills that are included in most of the DBT materials: wise mind, the what skills, and the how skills. So how to be mindful, what are some skills that need to be done in order to be mindful successfully? And then what is it that we're doing in order that we can be mindful? And we're going to cover all 3 of these. Wise mind is the first one, and this is relatively important. So some of that self-awareness and being able to identify where you are. So Dr. Lenahan describes 3 different states of mind. And for the record, none are good or bad. They all have their place. But it's being intentional about which mind we're in order to make the best decisions for us. So emotion mind, I'm going to start with on the left-hand side. So thinking and acting from intense emotion. And it may have a disregard for logic or reason. So folks that may be really passionate about things, there are times when this is absolutely necessary. A couple years ago, I lost my dad. That would be one of the situations where emotion mind may very much take over in order to deal with and process that particular loss. You may need to experience all of those emotions and have whatever type of release that you need at that point to be able to address that situation. I'm going to go to the opposite end of the spectrum, reasonable mind. So reasonable mind is acting out of reason and logic, and the actions are not influenced by emotion. Reasonable mind may not be the best coping mechanism when something very intense just occurred and there is a lot of emotional content. Reasonable mind may be very appropriate in other instances where there are chores that need to get done. There are things that need to get organized. So the start of school, what do individuals need for that? So there are times when that can be absolutely the best course of action in order to take steps to address the situation. But there's many instances where the synthesis of both the emotion and the reasonable mind need to be involved. So the decisions and the actions are a result of weighing some of the emotion as well as the reasonable mind and bringing them both together. So my color scheme being red, yellow, and the orange in the middle because it's a combination of both. So there are several activities and practice homework assignments that often are given to patients who are involved in DBT programs to ask them to really think about different situations. So I'm going to ask you right now and I will not make you report out. So, but to think about a situation that you've had that was somewhat memorable over the last week, where you made a decision and it's something that you're thinking about. What frame of mind were you in? So is it a situation where maybe you were feeling quite emotional at the time? So maybe things were going well, you just got good news. So maybe you were, your response was a little bit different as opposed to you had been plowing through that to-do list, going through things one at a time. And maybe the response wasn't quite as empathetic for someone who had come by just needing to chat and you were just trying to get your things done. So think about different situations in your life because chances are your response was when you were in one of these particular mindsets. That was one of the skills is wise mind. So thinking about where you are and what's driving some of your decisions so that you can take that control back and be intentional about it. Other skills for mindful, I jumped to the how skills first because this is how things get done. And I think it's important to keep this in mind. So non-judgmentally. So as we're evaluating a particular situation, do not judge. There's not evaluation, there's not interpretation. It's just looking and surveying what's happening currently. So trying to keep some of that baggage, maybe some of the assumptions that we're bringing that can cloud what the decisions are. It's trying to intentionally keep that out of it. One, mindfully. So engaging in one thing at a time at this moment. Past doesn't matter, future doesn't matter, we're focused on the now. So this would be the opposite of multitasking. As the self-described queen of multitasking, this tends to be tough for me. There are times I will put on particular music when I know that I really need to focus in. I'll shut my email off, like different things that need to be done so that you can get that alertness and focus on the situation that you're working on. This last one is my favorite because the one mindfully I admit fully I struggle with is effectively, doing it effectively. So we're not going to judge, we're going to be focused and attentive, and we're going to do what works. So selecting actions that are moving an individual closer to one's goals. It may not be the ideal, but if it's what works for you and it's moving you in the direction of the goals, then that's what it is. So there's not just one particular way to get things done. Now the what. So what is it for mindfulness? There are 3 different skills that fall into the what category, similar to the how. So observing, noticing things without assigning words. These can be internal things. They can be external things. And I think oftentimes this is part of what folks really focus on when they start to think about mindfulness. I find this one a little bit difficult, but it's really helpful for me. So observing is just noticing. You're not putting terms on it. You're not naming anything. You're just noticing. What does it feel like in your body? What are you seeing in your environment? But again, not naming them, just observing. And that can be really powerful to that picture, mindful, where the cloud bubble of the little person was full of all of those things. That can help clear up some of those things. So doing it one mindfully, being really focused on the moment right now, that's why that would be so important, because it would be hard to just observe if you're distracted by all those other thoughts and things going on. One of the other skills is describe. So starting to put the observations into words. These are facts. What is it that you're observing? It is not a judgment. It is not an assumption. It is not an interpretation. It is not an opinion. So what is it that you see? And we're going to look at a couple examples in just a second. And then participate. So being completely engaged in the activity. So 100% all in. Many times we may be like, yep, we'll do that, but you're also distracted by something else that's going on in the background. Maybe some of you are eating lunch and listening to me. Maybe some of you are checking your email or trying to catch up on notes while you're listening to me. The participation would be you dedicating some time to just 100% be focused on what you're doing right at this moment. And that can be tough to do, especially in a society that seems to praise and reward multitasking. So we're going to do just a couple quick activities so I can save time for the case. So with the what skills, as a reminder, no judgment, doing things mindfully, so being focused just on what you're doing. Observe is not putting names to it. So for this, I'm going to ask. I won't require the 100% participation. I can't see all your squares anyways. But I'm going to ask, I'm going to give you a minute in just a second here to just observe your breath. Observe your posture. Observe the internal feelings. Observe the external feelings. But just focus directly on your breath. And go. If your mind starts to wander, just bring it gently back to observing your breath. Bring that one to a close. So in observing the breath, that's one of the activities I like. As observe is not to name things. And I think that's one of the processes that you're engaged with all of the time, every day. And there may not necessarily be specific words that you would be looking for to really put to that. So that can be a nice, quick activity to help with the observe skill, just to pay attention, just to focus in. The second one that I included in activity 4 is describe. So this one I am going to ask you to weigh in, so you're welcome to unmute or to use the chat. So take about 30 seconds, and then I'm going to ask a few of you to describe what you see. So is someone willing to share what is it that you see in this picture?
Yes, I'm willing.
Go right ahead, Dr. Torum.
All right, I see 5, I would call them what, cartoon characters that have different physical expressions of their bodies and faces included, of course. In the middle, we see a female character expressing excitement. On the left, we see a character expressing fear, surprise, fear. Between them, we see one expressing anger. And then to the right of the middle character, we see one expressing sadness and fear. And to the right again, expressing sort of puzzlement, wonder, something like that. So you can give it different interpretations, of course, but we don't have to. In describe, I guess you said no words. So if it's no words, we just have to describe what we see in their physical behavior, I guess, or without giving it names.
Yes, so observe, you just look, no names. So observe, you would just look at the picture. Describe, I agree with you. So 5 characters, there are different colors. One character is purple, one character is red, one character is yellow. They have different body compositions, different body postures. What describe asks us not to do is make interpretations or judgments. I use this intentionally. I like Inside Out. I'm not sure why my phone's going crazy. I like this movie because it does have the characters that correspond with an emotion, but what describe asks us not to do is to identify that emotion. We can't determine what it is that someone else is experiencing. So our purple character, for example, even though the character's name is Fear in the movie, so he's purple. His eyes are big. His hands are clasped. His mouth is open. His leg is up. We don't know if he's about to flee or kick or what he's about to do, but that's what we see. Saying that we see fear, that's providing an assumption. I'm interpreting what I'm seeing, but that may not always be accurate. That may not necessarily be what's going on. I was specifically looking for anger here because he often comes to my mind when I think of this. Don't judge, don't make assumptions. So he's red. He has fists that are extended. He has fire coming off of his head. His mouth is open, his eyes are wide. Those are our described pieces. He's angry. Well, those may look angry. Maybe he's excited. Maybe he's just loud. So describe really is very concrete, and it really requires practice to keep the judgment, interpretation, and assumptions out. So that was, I specifically used this one. The disgust one I often bring up with my kids. Myth, yes, that is my assumption of what they are, but then I have to tell them, here's why I think that I'm seeing that. So describe it without that judgment or interpretation.
Thank you, Sarah. This is an excellent example of what you said before. Not to use words to describe interpretations, opinions, judgments. Excellent. Thank you so much. Good example.
Thank you. I picked it on purpose because I definitely screwed it up before. So, but just something to think about. You can do this at any time. You could do this when you're engaged in a number of other activities. And some of those other activities or other mindfulness type activities, so eating, walking, listening to sounds that are happening around an individual, you absolutely can use those skills. Just observing, then describing without judgment can be really helpful. Other potential activities that may be beneficial, so a grounding moment, tactical breathing. So some folks will call it box breathing. There's a few different ways it can be done. Sometimes it's 4 by 4. So inhale for 4, can be held for 4, exhale for 4, hold for 4. There's some tactical breathings that have a shorter inhale and a longer exhale. So maybe it's in for 4, but it's out for 6. There's some evidence that that can help activate the parasympathetic nervous system, that kind of help calm things down. And then that wise mind check-in. So as there's a situation unfolding, what mindset might I be in? I've done this a couple times. My daughter recently got her permit. So with her driving, I have tried to provide feedback in making sure that I stay out of an emotion mind as we're almost driving off the side of the road or running the stop sign. In my responses to her, because she does not respond well when my voice gets loud. So trying to make sure I stay wise mind there can be really, really helpful. So just a number of examples. You can Google them. There are workbooks that have a whole bunch of other examples, but this was just kind of a snapshot that I wanted to provide for you. I will end us here. So DBT is going to be, so a psychological structured therapy program. We're going to focus on the different areas. This was just the first one with those 3 skill sets. So wise mind and the what and the how skills. I will stop my share.